MRI, an in-depth exploration of technology, applications, and limitations. Magnetic resonance imaging, MRI, is a widely used medical imaging technique that allows physicians to visualize the internal structures of the human body. It employs a combination of strong magnetic fields, radio waves, and computer algorithms to generate detailed images without using ionizing radiation. MRI provides exceptional soft tissue contrast, making it an invaluable tool for diagnosing and monitoring a wide range of medical conditions. In this comprehensive article, we will delve into the various aspects of MRI, including its principles, techniques, applications, indications, contraindications, analysis, and emerging trends. Principles of MRI. MRI is based on the principle of nuclear magnetic resonance, which involves the behavior of atomic nuclei in the presence of a strong magnetic field. When placed in a magnetic field, the atomic nuclei align with the field and absorb radio frequency energy when stimulated by pulsed radio waves. After the radio frequency pulse is turned off, the nuclei emit this absorbed energy, which is captured by specialized detectors and processed to create images. Magnetic fields and equipment. MRI scanners consist of a superconducting magnet that generates a powerful and uniform magnetic field. The main magnet is usually cylindrical or donut-shaped, and the patient lies within the bore of the magnet during the scan. The scanner also includes gradient coils, which produce small variations in the magnetic field to spatially encode the emitted signals. Radio frequency coils are used to transmit the radio waves and receive the signals from the patient's body. MRI techniques. A. T1 weighted imaging. T1 weighted images highlight the differences in the recovery of longitudinal magnetization between tissues. This technique provides excellent anatomical detail and is particularly useful for evaluating anatomy and distinguishing normal from abnormal tissue. B. T2 weighted imaging. T2 weighted images emphasize differences in the relaxation times of tissues. This technique is highly sensitive to fluid content and is valuable in detecting edema, inflammation, and other abnormalities. Circuit diffusion weighted imaging, DWI. DWI measures the movement of water molecules in tissues. It is commonly used to evaluate acute stroke, brain tumors, and other conditions where tissue integrity is altered. D. Magnetic resonance angiography, MRA. MRA uses specialized imaging sequences to visualize blood vessels. It is utilized in the diagnosis and assessment of conditions such as arterial stenosis, aneurysms, and vascular malformations. E. Functional MRI, fMRI. fMRI measures changes in blood oxygenation to map brain activity. It is employed to study brain function, localize eloquent areas before surgery, and investigate neurological disorders. 1. Applications and indications. A. Neuroimaging. MRI is extensively used in neurology to detect and characterize brain tumors, multiple sclerosis, cerebrovascular diseases, and neurodegenerative disorders. B. Musculoskeletal imaging. MRI provides detailed evaluation of joints, ligaments, tendons, and muscles. It aids in the diagnosis of conditions such as fractures, sports injuries, osteoarthritis, and tumors. Circumabdominal and pelvic imaging. MRI is valuable for assessing the liver, pancreas, kidneys, uterus, prostate, and other abdominal and pelvic organs. It assists in detecting tumors, evaluating congenital anomalies, and staging various malignancies. D. Cardiovascular imaging. Cardiac MRI allows non-invasive evaluation of heart structure, function, and blood flow. It is used to diagnose heart diseases, myocardial infarctions, and congenital heart defects. E. Breast imaging. MRI plays a crucial role in breast cancer screening, especially for high-risk individuals. It helps detect and stage breast tumors, evaluate treatment response, and guide surgical planning. 1. Contraindications and safety considerations. Although MRI is generally safe, certain conditions and situations can limit its use. A. Presence of metallic implants or devices. Some metallic implants, such as pacemakers, cochlear implants, and certain aneurysm clips, can be affected by the magnetic field. 1. However, newer implants are being developed to be MRI compatible. B. Pregnancy. Although MRI is generally considered safe during pregnancy, it is recommended to avoid it during the first trimester unless absolutely necessary. Circuit claustrophobia. The confined space of the MRI scanner can trigger anxiety or claustrophobia in some individuals. Open or wide-bore MRI scanners are available as alternatives. Image analysis and interpretation. Radiologists play a vital role in interpreting MRI images and providing accurate diagnoses. They assess image quality, identify abnormalities, compare with previous scans, and integrate clinical information to formulate an appropriate diagnosis and treatment plan. Emerging trends and advancements. A. Ultra-high field MRI, higher field strengths, such as 7 Tesla, offer improved spatial resolution and tissue characterization, allowing for better visualization of small structures and subtle pathological changes. B. Functional connectomics. This emerging field aims to map and understand the functional connectivity of the entire brain using advanced MRI techniques. It has the potential to enhance our understanding of brain function and neurological disorders. Circa artificial intelligence and machine learning. These technologies are being increasingly applied to MRI data analysis, aiding in automated image segmentation, lesion detection, and decision support systems. MRI has revolutionized medical imaging by providing high-resolution images with exceptional soft tissue contrast. It has become an indispensable tool in the diagnosis, monitoring, and treatment planning of various medical conditions. With ongoing advancements, MRI continues to evolve, enabling new insights into the human body and enhancing patient care.